Well, a very warm welcome to this talk and a happy, reflective and contemplative Good Friday. Now, as you'll see, we're still running on somewhat limited technology. We're actually working in Australia with Professor Robert Clancy, and more to come on that over the next few days, hopefully, but interesting developments. Now, I've been talking to Professor Angus Dalgleish. Now, with Professor Clancy, Professor Dalgleish has been one of the clearer thinking minds on this pandemic, and I was just talking to Angus Dalgleish recently on the phone, and we've agreed to do an interview on this topic when I get home. But there's something I want to bring to your attention, and it's an article. Again, this is fully referenced. I'm going to give it all to you. It's by Angus Dalgleish, a professor of oncology, one of the most senior physicians in the country actually, and he's written this article: mRNA vaccines must be banned once and for all, in the opinion of Professor Dalgleish. Now, let's see what his rationale for this is and see if it makes sense. Now, he says this, and we reported on this in some detail at the time and recorded a video with Professor Dalgleish on this. At the end of last year, I reported I was seeing melanoma patients, that's the skin cancer, but of course it spreads all over the body. Melanoma can kill you actually really quickly. I've seen patients die of melanoma in months, not years. But Professor Dalgleish has been keeping his patients alive for 5 years, 10 years, 15, 20 years, I believe. Quite remarkable success in oncology. So at the end of last year, Professor Dalgleish said he was seeing more melanoma reactivation, seeing melanoma patients who had been stable for years relapse after their first booster, that's the third injection. And he also says in this article, which I'm going to give you the reference for, the number of my patients affected has been rising ever since. So stable melanoma patients, cancers reactivated after the booster. Now, if Professor Dalgleish says this should be taken seriously. And all we need to say there's no problem here is for the regulatory authorities to stand up and say, Professor Dalgleish is wrong, there is no reactivation of melanoma after booster doses of vaccine. Clear the decks, then we'll know where we stand. So far, I haven't heard them say that. So, other oncologists have contacted me from all around the world, including Australia and the United States. So, being one of the leading oncologists in the world, Professor Dalgleish obviously has international networks and is being contacted by colleagues from Australia and the United States. And after booster doses, these colleagues are reporting more lymphomas. Now, lymphoma is a potentially deadly cancer of the lymphatic system. You've probably heard of Hodgkin's and non-Hodgkin's lymphoma. So more lymphomas being reported to Professor Dalgleish, more leukemias being reported to Professor Dalgleish, a group of cancers that affect the blood. More kidney cancers are being reported as well. And then Professor Dalgleish says this: my colorectal cancer colleagues reporting an epidemic of explosive cancers. Explosive cancers doesn't sound good. Those presenting with multiple metastatic spread, the liver and elsewhere. So what very often happens is a cancer will begin in the colon and then it then spreads to the liver. And of course, ideally, you would pick it up when it's still just in the colon and be able to resect it, get rid of it, treat it, hopefully just with endoscopy. But if it's already spread to the liver, the prognosis is very gloomy indeed. And if Professor Dalgleish is saying this, again, all it needs is the regulatory authority to stand up and say, you know what, we've looked at this, there is no increase in lymphoma, there is no increase in leukemia, there is no increase in kidney cancer, there is no increase in colorectal cancer, and if there is, it's certainly not attributable to COVID vaccines. Just stand up, say that, be clear. It's not, I mean, if it was me saying this, then of course they could reasonably ignore me. But this is not me saying this, is one of the world's leading oncologists saying this. And it's a question that should be answered. If there's no problem here, say there's no problem, clear it up, we'll all go home and we'll start thinking about infectious diseases and other problems around the world, of which there are many. So there we are, more reactivations of melanoma, potentially lymphomas, leukemias, kidney cancer, colorectal cancers, often presenting at a late stage. Please, regulatory authorities, dismiss this, say it's rubbish, and reduce my anxiety levels. Now, Professor Dalgleish has got a good track record. He knew from the beginning that SARS coronavirus 2 contained inserts indicating potential laboratory manipulation. He said right from the start the vaccine didn't stay at the site of injection. He said right from the start there was batch-to-batch variability. And these alarms were brushed off by regulators, and of course now we know that many of them have been substantiated by thorough scientific evidence. And he also talked about DNA contamination. Now, why are so many cancers occurring? Now, Professor Dalgleish does address this. T-cell suppression was his first likely explanation. So the T-cells, the immune lymphocytes, recognise cancer, kill it at an early stage. Is that the problem? But now he says this: however, we must also now consider DNA plasmid SV, simian virus 40, integration in promoting cancer development. So what we need now is a regulatory authorities to stand up and say, you know what, there is no DNA contamination in the vaccines. Well, they're not saying, I don't think they'll say that, because we know there is. The ones that are made from E. coli preparations, at least, which is all of them, I think, being sold at the moment. So stand up and say, you know what, this there's no simian virus here, SV40. This promoter of cancer is simply not there. You're worrying about nothing. Then I'll go, phew. Thank goodness for that. Sorry, I thought we might have had a problem there. That's all they have to say. mRNA, FDA, just stand up and say that, please, and then we can forget about this. There we go. Reports that mRNA spike protein bind to P53 and other cancer suppressor genes is another possibility. Now, what we have here is we have genes which suppress cancer. They reduce the mitotic rate, the cell division rate. They're called cancer suppressor genes, or oncosuppressor genes. There's also oncogenes which can promote cancers, which increase cell division. But Professor Dalgleish here is concerned that the mRNA spike protein binds to cancer suppressor genes and stops them working properly. That's his fear. Now again, regulators just say, no, you know what, mRNA vaccine spike protein doesn't bind to P53 or the cancer suppressor genes. Forget about it, there's no problem here. But this is a question that should be answered. Professor Dalgleish says this: to advise booster doses, as is currently the case, is no more and no less than medical incompetence, depending on the country you're in, of course. No ifs, no buts any longer. The mRNA vaccines must be halted and banned now. Unless the regulatory authorities want to say, look, there's no problem here, Professor Dalgleish is wrong, then we'll all go home and forget about it when we've been reassured. Until that point, I am concerned. And on the comments, we're getting so many cancers, especially in younger people. I'm not going to name individuals, but we all know that this is in the news at the moment. Now, just before we finish, Eurostat, the European Statistics Agency, circulatory disease and cancers accounted for 54% of all European Union deaths in 2021. Of course, people sadly die. So in 2021, there were 5.3 million deaths in the European Union. Circulatory diseases, 1.7 million, cancers, 1.4 million. They were the most two common. And of course, we know that circulatory diseases have been increasing really quite dramatically, at least in England as of late. Heart failure especially rapidly increasing or very high in incidence. Then other things, respiratory diseases, gastrointestinal diseases, all listed, of course. Now, Eurostat in 2022 reported a lot of excess deaths. April, it was 12% more than normal. May, it was 7% more than normal. June, it was 7% more than normal. July, it was 16% more than normal. We know this continued into 2023. Now, 2024, we've actually got the data for January. Eurostat data, overall for the European Union, it was 3.6% deaths more than we would expect above baseline. But it does say this: in January 2024, the highest excess mortality rates were in the Netherlands, 15.3% in January 2024. Denmark, 11.5% in January 2024. And Germany, 9.9% in January 2024. Now, it does say in January 2024, excess mortality continued to vary. Now, which countries do you think had lower values? Romania, Bulgaria, Hungary, Lithuania, Croatia, Luxembourg, Slovakia, Poland, Latvia, Czechia had no excess deaths. What could be a link here? So there's very high excess deaths in these westernised countries, and in the more eastern countries, lower excess deaths. Well, we have the Bradford Hill criteria to adjudicate on that. And we've talked about that in the past. So I am concerned. Netherlands, excess deaths, January 2024, this is continuing. 15.3%. Denmark 11.5, Germany 9.9. It's continuing. This is a concern. We need to work out what is causing this. Good to see that in Australia, the Senate are going to investigate the causes of excess deaths. They're making no assumptions, they're just going to investigate the cause of excess deaths. This needs to happen in all countries around the world, in my view, and Professor Angus Dalglish's concerns need to be squashed by the regulators, and we await their response. So for now, thank you for watching.